Review today is how to access Medicare.gov, right? From there, we're going to access the health plans for your members, the Medicare Advantage plans. We're going to do some side-by-side comparisons of the plans in the area. We're also going to check for drugs and how to select the right pharmacy, and then give your members a review of what their costs should be for the year, okay? So this should take a few moments. So you want to log into Medicare.gov, which I already logged in right here. And from this point, what you want to do is find health and drug plans. Okay, so you want to click on there. And what you want to do from here is continue without logging in. The reason why you do not want to go log in or create an account is because if you log in and create an account, you have to log in and create an account for your member, which means that you're going to need like their information, their address, their phone number, in most cases, social security number, bunch of information that you may not have privy to you. But for today's purposes, we're just trying to get a quote for your clients. Okay, so you continue without logging in, and from this point, what you're going to do is you're going to click on Medicare Advantage, right? And you're going to scroll down. You're going to type in your zip code. Today's 92705 is the zip code we're going to use, which is over in Santa Ana. And then press continue. And it's going to ask you, do you get help for any of these costs, these programs, Medicaid, supplemental insurance, extra help? I always put, I'm not sure. Because if I'm not sure, it's going to give you everything that's available for the member. If you put Medicaid, it's only going to show you the plans associated with Medicaid. Okay, so the best thing to do is I'm not sure, right? And then the same thing, continue without logging in. And then, do you want to see your drug costs when you compare plans? Yes, you want to do that. And then the question is, do you normally fill in your prescriptions? How do you fill in your prescriptions? And you want to go both, because if you just do retail, it's just to show you the cost on the retail, but you also want to give your client the option if you do mail order, which is 90 days, what the cost will be, okay? So go to next. And then what we're going to do is we're going to type in one medication right now just for our discussion. So one of the medications we're going to type in today is going to be Januvia, right? So typically what happens when you start typing the first three letters, the medication should pop up. So we're going to select Januvia, and then we want to add drug, right? And when you speak to your client, you want to get specific on the dosages. You don't want to quote him 25 milligrams when they're actually taking 100 milligrams, right? Because that could throw off the quote and also the price itself. So, and also the carrier who might cover it, right? So we're going to select 50 milligrams for today. And the quantity is also very important, right? You want to know if they take it every day, they take it once a month, how often they take the medications, right? So this person, we're taking a quantity every month, which is basically take one medication per day. At that point, from here, you're going to add to my drug list. Click on there. Now, if you need to add, as you can see right now, it's going to show the Januvia, 50 milligrams, quantity of 30. You take them every single month, right? Now, if you need to edit it, you can also click on edit. But we're not going to do that today. Now, if you need to add more medications, you want to find and add drugs, you would click on there. But today, we're not going to add more on there. So our medications are completed. So let's go to add or done adding drugs. Click on there. Now it's going to give you choose up to 5 pharmacies within the area. So again, we chose 92705, right, which is in Santa Ana. Automatically, based on our earlier selections, it's going to include mail order. Plus, it's going to give us 5 pharmacies in the local area that the member could select. So normally, I always check the CVS, the Rite Aids. And I also check the Walgreens because those are pretty, they're everywhere, right? So you want to ask your member what pharmacy they go to, because there might be one of these pharmacies that are local that you're unaware of. So we're going to click on Cancer and Blood Care Specialist, and we're going to click on Cura Pharmacy. And as you can see on the bottom, we have 4 pharmacies plus the mail order. So when we run our quotes later on, it's going to give us a quote based on these 4 pharmacies and also mail order, okay? So we selected 4 And as you can see on the map on the right-hand side, it's going to give you an idea where these pharmacies are located. Okay, so click Done. And then at this point, it's going to show us 60 Medicare Advantage plans, okay? However, we're not done yet. See where it says 10 of 60, it'll show you the plans on that page. However, let's say your client is diabetic, or let's say your client is Medi-Medi, right? So this is only going to show you the Medicare Advantage plans in the area. So if your client is Medi-Medi, see it says 60 right now, I'm going to add special needs. So I click on people for Medi-Medi, both Medicare and Medi-Cal, and it goes from 60 to 66, okay? And if they also have a chronic condition, right? So click on the chronic condition, and now there's 83. So in the total area in Santa Ana, there's 83 plans. 83 plans, man. Imagine you're in one of these counties that only have 2 plans, right? A little bit easier. But in Orange County, you have 83 plans available. That's including full Medicare. That includes those are Medi-Medi. And that also includes the people that have a chronic condition such as diabetic. It also shows here stroke, cancer, dementia, but the major ones would be COPD and those other ones. So if you disconnect those, so we're going to disengage those. So it goes from 86 down to 60, okay? If you go to the right, you can sort. And most of the times, actually probably 99% of the time, I'm going to select lowest drug and premium cost because that's what I want, right? The lowest cost drug here, right? When I say 99%, typically what happens, you may run across a member who, let's say they're already on a Medicare Advantage plan, right? So what you want to do is lowest to drug cost, right? You click on those. I take the 2 lowest ones, obviously if the doctor accepts. And at that point, what we want to do is that we select the top 2 here, because these are the lowest, right? Add to compare. And then I'm going to go the platinum, the alignment platinum. So let's say your member, he doesn't use one of these plans. Let's say the member goes scan, right? So I'm going to find the scan plan that the member has. Let me see. Where's Scan it? Oh, I guess Scan's not a good plan. Sorry, Scan. Let's pick another plan. I'm sorry. We're doing this live. Let's say your member has Central, right? So I'm going to click Central. And the reason why I'm doing this, because I want to do a side-by-side comparison with the other 2 plans, the 2 lowest out-of-pocket expense next to what they pay for, okay? So once we get that, so again, the 2 lowest costs are Inter Valley for our purposes here, and also got the Alignment Platinum plan. And we also have Central, which is what the member has for our purposes here, okay? Now we press compare. And at this point, it's going to give all 3 of the plans as we selected on the side-by-side comparison, right? We got Inter Valley, we got Platinum, and we have the Central Health Alignment Platinum. It tells you what our out-of-pocket network is. Maximum out-of-pocket, 1,000. The alignment is 800, and the Central is 1,800, okay? As we scroll down, it's going to give you more side-by-side comparisons of not only the maximum out-of-pocket as we spoke about, but also any deductibles, plan deductibles, and it's going to give you a kind of a real highlight snapshot of some of the features they include, such as vision, dental, hearing, transportation, worldwide coverage. As you can see, the Inter Valley plan does not have in-home services, nor does the alignment, but your client's Central plan does have in-home services. Okay, so kind of a brief overview real quick. So when you're speaking to your client, you can ask them what things are important, right? So this is just going to give you a bird's eye view. Okay, so you scroll down a little bit more, it's going to show you what the co-pays are side by side, any labs side by side. You keep on going down, the hospitals, what the cost is, 0 co-pays, extra benefits, hearing aids, covered, not covered, some coverage, skilled nursing facility, drug cost, whole array of things. And it's also going to give you, now we talked about the pharmacies. So it's going to show you if there's an X, that's going to tell you the pharmacy that's not a network. If you show a green little box there like it is with the CVS, for this specific carrier, the CVS is in network. If you're going to go through the Inter Valley, the CVS is out of network in this specific county, okay? So you scroll down. Now, here's the fun part. Now we want to get into the medications, right? So you want to click on plan details. Now this is going to expand that specific carrier, Intervalley, right? It's going to go over again the premiums, the monthly out-of-pocket expense, the health plan. Keep on going as we go down here. The benefits, as we saw earlier, doctor's visits. But the nice thing about this is also going to give you the medications as you scroll down towards the bottom. So if you scroll down to the bottom, it's going to give you the medications, right? What the cost is, okay? The tiers associated with the medications, right? These are going to be the tiers for all their medications, right? Now, if you scroll down towards their pharmacy, it's going to show again the pharmacy. So we selected in this situation with Intervalley. If you go back up again, it's going to show you the CVS is out of network. It's going to show you the local pharmacy, which your member goes to, is in network. The cancer and blood specialist is out of network. The all care specialty pharmacy, in network. Again, green box means good. X box means it's out of network. Okay. So if you scroll down here, it's going to tell you the CVS pharmacy. So now let's look at this. So the CVS pharmacy, it's going to give you the cost of the medications, the deductible, all the gaps, all this cost after the coverage gap. Now it's also going to give you the estimated cost. So you pay $5,900 all year for the drug cost plus premium, right? It's also going to tell you you're going to hit the coverage gap in October. And then you're going to exit the coverage gap in December. So for today's purposes, we did this in February. So it's going to show us, if we scroll down a little bit more, it's going to show us what the member is going to pay every single month. So in March, I'll check my glasses there. It's $596, my bad, $596. And it's going to show you every single month that they're going to pay, right? So again, it's going to be close to $5,000, almost $6,000 for the year with the medications. And again, this is a pharmacy that's out of network. So the Cure pharmacy, which is a network, is only going to be $110 for the year. That's crazy. That's over $5,500 in savings if they go to a preferred pharmacy. That's standard in network, right? So again, it shows you what they're going to pay. It's going to enter the coverage gap in December, and they're not going to exit. So the other one is going to be, go back up. It's going to show you that if they use that pharmacy, they're going to enter the coverage gap in October, and they're going to exit in December. And they're going to pay close to $6,000 annually for this medication, which is huge. So if you do have a client and they prefer CVS, you can say, hey, if you go to the local pharmacy, which is probably another mile away from your home, you're going to save yourself thousands and thousands of dollars. Okay, so this is pretty straightforward. As you scroll down, we can find out more and more and more and talk about the plans that are nearby. The cancer one's out of network. The other ones are in network. All care is in network. That's 110 also. So really, really nice way to present this to your client. I would recommend you print this out, save it in a PDF. If you go back, I forgot to tell you, if you do decide to go estimated drug costs, it also tell you towards the bottom here if you pay it on every 3 months there. Okay, so that's pretty straightforward as far as the medications and Medicare.gov. As I was indicating earlier, what you want to do is when you want to save this in a PDF. In years past, Medicare.gov used to allow us to save these with an ID number, but they no longer offer that. So again, I recommend you either print it out, put it in the client's file, or save it as a PDF so you can go back and you're able to access information. Okay, so this is the Medicare.gov, how to go to there. One of the things I do recommend, and I'm telling you right now, once you get a plan you're going to select and you see all the medications and the cost, you want to go to the carrier to verify this information is correct. So again, it could be medications are a little bit different than Medicare.gov, and then the carrier might be off a penny or so. So again, we went back to the screen here. These are the 3 plans. Now, if you want to disregard a plan, you can just click up here on one of the X's, and that's going to remove the plan. And now you've got 2. Now, if you want to add another plan back in, you can. So you want to go to back to results. And this will give you the Medicaid, all the other plans again, right? So you can add them back in, whether your member doesn't like, Intervalley, or they don't like alignment, or their doctor doesn't accept that. So you don't necessarily don't have to get the top 3. But again, you want to make sure if you do have somebody that's on a Medicare Advantage plan, you want to for sure add their plan and then plus 2 other plans that are hopefully their doctor accepts. And if the doctor doesn't accept it, then you want to do is, again, look at the top or the least amount of cost that's exposed to your clients and bring those to your attention and say, okay, a side-by-side comparison. You have the Blue Shield or you have the Central plan. Your doctor doesn't take Intervalley, your doctor doesn't take Blue Shield, but if you go with the Blue Shield plan, you're going to save yourself thousands of dollars a year, for example, okay? So this is Medicare.gov, how to go through it. If you have any questions, you can always reach out to me. You can call a recruiting department. Otherwise, have a wonderful day, and I will talk to you later. Thanks, bye.